general practice is exactly that. It is general practice. It's the fact that it's cradle to grave care and everything in between. We do antenatal care, we're looking after the small babies, we're looking at children throughout their childhood development, we're looking at adults at the various stages of their life, and we look after people both as they get older and at end of life. So it's literally cradle to grave care. I suppose the thing is, one of the things I'm very passionate about is that we would provide good general medical care. General practitioners remain the one generalist physicians that are left, and therefore in the given day we will cross all the various systems in the body. And what we do is we use evidence-based medicine to provide the best care we can that we are comfortable to do. I think first and foremost they will get very good broad general training. I know that all my colleagues in the training scheme, they have urban and rural practices, but we're talking about urban as in the context of Tralee and Killarney, Listowel and so on, and then rural practices like our own here. And in that kind of context you're going to see a great broad spectrum of the medical care that I've been talking about. The other bit of it is that within our main teaching hospital, which is University Hospital Kerry, again because it is the general hospital for Kerry, you get to see pretty well everything. For people who require tertiary level care, we obviously have access to Cork University and University Hospital Limerick, but the bulk of the patients are looked after here locally, both in the University Hospital, and indeed I should say we have a private hospital in Tralee as well, the Bonsecourt Hospital. So a lot of our patients across a huge spectrum of medical problems, and indeed surgical and obstetrical and orthopaedic and so on, and paediatric, are all looked after here locally. So I think the thing about coming to Kerry for the training is that you'll get a training that will stand you. We would hope you might consider staying in Kerry afterwards, but irrespective of where you go, you'll carry away from it a spectrum of knowledge that will stand you in good stead no matter where you decide to practice afterwards. We don't have a specific primary care centre, but our practice here, along with 4 other practices between the town of Castleisland and Farnfore, look after a population of about 15,000 people. And over the last 10 years there's been quite a good team developed. We have 2 physiotherapists, occupational therapists, speech language therapist, dietitian and diabetic nurse specialists, along with the mental health team and the public health nurses, and we all actually work very closely with each other. There is good rapport and good contact, and I suppose the thing is that it gives us a whole set of options. I think it's probably the best word I'd use, both in terms of providing solutions to people, but actually thinking up solutions. And what I will do is using secure email, I can liaise with my colleagues on the team, and we can between us look for solutions to a whole range of problems. So it's a team effort, even though we don't necessarily physically meet face to face, because we know each other quite well. It does mean that there's great opportunity for collaboration. What we do try to do is to practice to the best of our abilities using the best evidence-based medicine, and we work by the guidelines and right across the spectrum of the chronic illnesses. So for example, we look after our asthmatics, our diabetics, COPD, chronic heart disease, chronic kidney disease, really the whole spectrum of medical problems, and do that to the best of our ability.
So I'm here 2 months now, and basically you're learning as you go. You're thrown in at the deep end. The door opens, a patient walks in and you don't know what they're going to have. You see a variety of things, from the common cold flus where you just reassure and give them a bit of advice, to more serious things that need urgent referrals, whether that be if you're very suspicious of a cancer, or you see a lot of trauma walking in the door as well. So you never know what you're going to get, but it's exciting. Yeah. Well, as part of all GP training, you have to do medicine, psychiatry and paediatrics for 6 months. So in Kerry, you get all those. Then after that, you have 3-month placements. And in Kerry, we do obs and gynae, which isn't available in every training scheme, and we do A&E. You get a wide variety. It's a small hospital, but you do get all the training you need there. The hospital is friendly because it's small, everybody knows each other, and it's very handy that you do all your training in the one hospital. You're not moving from one hospital to another, so you get to know staff members there, and you're there for 2 years. So it's a nice place to work. It's nice to be able to go to the same place every day for 2 years and not be moving around.
there is a great lifestyle in Kerry. Cost of living is not what it is in other parts of the country, plus the fact that you will get a training here that will stand you in good stead no matter where you go. Although we'd love it if you stayed in Kerry.